Okay, and with that, we're going to begin. Hi, everyone. Welcome to our release webinar for our new resource, the Circle of Care Guidebook for Caregivers of Children with Rare and or Serious Illness. My name is Lauren DeCarwich. I'm the Research Manager for the National Alliance for Caregiving, and I've been managing this project for some time now. I'm going to pass it on over to Grace, the President and CEO of the National Alliance for Caregiving, so she can welcome us all.
Thank you so much, Lauren. As Lauren mentioned, I'm the President and CEO of the National Alliance for Caregiving. And if you don't know us, our mission is to build partnerships in research, advocacy, and innovation to make life better for family caregivers. I am especially excited today to talk with you about this project. I know it's the afternoon, and for many of you might be the lunch hour. You have lots of places you could be, and I'm so appreciative that you've decided to spend this hour with us talking about this critical new resource for friends and family who care for children with rare or serious illness. As we get into the discussion today, I want to just thank a couple of people who made this work possible. First and foremost, Lauren DeCarwich, who is our research manager, has really shepherded this project from start to finish and helped to make it real and to create a new resource that incorporates both lived experience, research from our quantitative 2018 study, as well as focus group and listening sessions, and the insights of many of the experts and family caregivers that you'll hear from this afternoon. I also want to thank Mellencrop Pharmaceuticals for their role in providing us generous charitable funding that allowed us to create this guidebook, a guidebook that really rose out of the need that we were made aware of by rare disease families. In so many ways, many of the resources that are available to caregivers focus primarily on caregivers of adults. And this is a chance for us to look at what's unique about those who are caring for children. Finally, just a couple other folks on the staff at NAC that made this possible. My colleague, Michael Whitkey, who is our Vice President of Research and Advocacy, and my colleague, Patrice Hines, who is the Vice President of Strategy and Operations. Last but not least, this is an ongoing partnership with Global Genes, which is an umbrella organization that helps to prepare people and families who are managing rare disease for the world out in front of us. And we have been big fans of the work that Global Genes does to provide new avenues for people who are living with rare disease, their family caregivers, industry partners, and others to advocate for a better future, to find support between each other, and most of all, to find hope in what sometimes can seem like a hopeless situation. So with that in mind, I'm going to pass it on. Let's get started with the program. And you are welcome to share your thoughts and comments in the chat box as we spend this time together this afternoon.
I wanted to let everyone know as well that there will be time for questions at the end, but if you have questions throughout the webinar, please feel free to put them in the chat box and we can have them asked during that time. So next I want to introduce Parvathy Krishnan and Danielle DeFabio. They are both from Global Genes. They're here to tell us why the guidebook was important or is important. Parvathy is the Foundation Alliance Manager for Global Genes. She is a speaker, panelist, and often serves on national and international boards to promote patient and caregiver experience. And she's also a mom to 2 medically complex children. Daniel is the Associate Director of Community Engagement at Global Genes and the father to a son with the rare disease Menkes syndrome. Daniel has documented his son's story in a documentary and co-founded Disorder, a rare disease film festival, as well as the Disorder channel to spread awareness about rare disease. So now I'm going to pass it on over to Parvathy.
Thank you so much, Lauren. Good afternoon, everyone. It's such a pleasure to be here presenting with the National Alliance for Caregiving. On behalf of Global Genes, we're so proud to be here associated with this project. I can spend the whole hour talking to you about everything and why this book would have just been perfect to me the day I received the diagnosis with both my kids, but as you can see here, that's my family. I'm mom to 2 kids with rare and ultra rare conditions. There are 2 sections in this particular book that just spoke volumes to me that I wish I had known throughout the journey, and I'll mention those two parts specifically before we get into the rest of the program. One part was the emphasis and focus on palliative care and hospice care for pediatrics. It is not easy dealing with that, dealing with a diagnosis, dealing with the fact that we may have to do palliative care or hospice care, but the unique difference between pediatric palliative care and pediatric hospice care and what we normally hear out in the world is that it does not mean end of life. And this book just so perfectly captured some of those emotions and explained it in more detail. And I wish that as a new family, I had learned that this could be a part of our care, and this could be something that we would be potentially doing. And in our case, we did do that with our daughter. We did go through palliative care and we did use hospice care towards the end. But in a stark contrast, my son, who's still healthy and 13, but very medically complex, continues to have their care. So I'm so thankful that the amazing authors and everyone in this project worked together to highlight that, along with highlighting all of the foundations that give back, and specifically the Make-A-Wish Foundation, the wish granting organizations, because usually those are not associated or come to our mind when we think about rare disease. And so I definitely, as a parent, I wish I had that book when we started this journey 8 years ago, but I'm so thankful that all of them have put that together now to help everyone else who's going to be needing it. With that, I turn it over to Danielle.
Thank you. And thank you to everyone at NAC that put this together. I definitely agree with Parvati that this is the book we wish we had. And I'm sure that's why this book now exists. There's so many of us that felt, and I've said it myself, we often say there's no guidebook for rare disease. Well, it seems like now there is one. And this is everything you needed to know and maybe found out in some of our cases the hard way. And so now there's a single collection where I can't believe you can't cover everything, of course, but in 55 pages, it sure seems like you covered everything. And I definitely agree with the comment Parvati made about palliative care. That's something that I could only appreciate a bit later than I wish I had because of sort of the misunderstanding of what palliative care is. And this book does a great job of disabusing people of that stigma that it may have. And also, as you get in the book to building a care team, definitely something I needed more information on earlier in the process with my son. It's just a great resource. I can't believe how many things I hadn't thought of needing to know, and now I see them listed out here. So kudos to all of you on your work on this, and look forward to hearing more of the conversation today.
Thank you both. All right, I'm going to pass it on to Katie Sakra. Katie wrote the foreword for the guidebook as a family caregiver. She's the director of family programs for the Global Foundation for Paroxysmal Disorders, and most importantly, is a mom and caregiver to her adult son who's living with a rare disease. She's the co-founder of Bubba's Light, a nonprofit organization created to connect and support people in the rare disease community. She is passionate about empowering others through advocacy, family support, and working to bridge the gap between families and professionals.
Thank you so much for having me. I'm so grateful to be a part of this. And I'd like to start right at the beginning, right after that welcome, and talk about the table of contents briefly, because I think if you look at the table of contents alone, you'll be able to see all the different areas that a caregiver is very likely managing all at once. And if you look at the next page of acknowledgements in the book, you'll be able to see that it took a lot of people to be able to create this guidebook. And a guidebook that wasn't thousands of pages. I think Daniel just spoke to that and saying it's amazing how much was packed into so many pages. But it took all these people collaborating to achieve this incredible result. It took an advisory committee, expert reviewers. And if you just look between those 2 pages alone at all the people that were involved to organize and create this content, and then stop and realize that a caregiver is at any one time trying to manage everything you see on that table of contents. And they likely don't have the support that they need and deserve. As a caregiver, we're all exhausted, and time's not something that we have anything extra of. So sitting down and reading through yet another resource with hope that this is going to be the one that can help me, that's really overwhelming and stressful to think about. And as a caregiver myself, I'm here today to just share this is a valuable resource. This is one that will give you hope. This one that it can lead to help that you need, the support that you need and that you deserve. I love how this book is organized in such a way that it's not something you can pick it up, you can put it down. You don't have to have a lot of time set aside to read through it all in one sitting. In fact, actually, it's a resource that I think that can be picked up, put down, and used over time, depending on what season of caregiving that you may be going through. You just heard from previous caregivers the aspects of the book that really spoke to them. And I think we all can grab different pieces that really speak to us at different times. As a caregiver, I believe this care book is a guidebook that can and should be used by anyone who knows a caregiver or someone who even serves as an individual who's supporting the caregiver or the person who is receiving the care. Pediatricians, metabolic and developmental pediatricians, while pediatrician may have limited knowledge about the actual rare disease, it doesn't mean that they can't have knowledge to know how to better support the caregiver. Palliative care professionals, geneticists, neurologists, each specialty focuses on one area. And as a caregiver, remember, we're managing all of those areas, including the areas that are not medical. This book, its table of contents, that page alone gives a really quick and important picture of all the many different areas that we caregivers are managing all at once. Educational professionals, special education teachers, therapists, case managers, individuals working with agencies who serve individuals who receive care, family members, friends, genetic counselors, social workers, family engagement leaders, child life specialists, disease-specific organizations, and advocates. You may be interacting with caregivers and be in a position to identify needs. This book can be used to facilitate the needed and deserved support for caregivers. In some way, we are all likely connected to someone who's a caregiver. This guidebook is not only a resource, but an opportunity to bridge that gap between the caregiver and all the many people they interact with to ensure the individual they care for is receiving optimal care, to bridge the knowledge gaps and the crucial role of the caregiver and how that experience can impact the individual who's receiving care. This is a huge opportunity just by having this book, reading this book, sharing it. There are powerful tools within it. When I wrote the welcome in the guidebook, I spoke to how much I wish I would have had this and how great this was going to be for other caregivers, and it will be. But I realize now, and I want to emphasize, how much I wish other people, family members and professionals, would have actually had this guidebook. I wish when I was so overwhelmed and receiving a rare disease diagnosis from my own son that I couldn't even think about finding the time to read another page or look for another resource. I wish the professionals and my friends and my family had had access to this book and that they would have been the ones coming in and out of my home and in and out of exam rooms and identified maybe something that I need. And this book would have told them how they possibly could have helped me or relate to what I was going through. I'll finish up with a thank you. I'm very grateful again to be included in the launch of this guidebook, to be able to share this with others. Please know that each of you joining us today, when you share this guidebook, you're effectively helping others and making a difference. Each person who shares this is advocating and showing their support for me, for caregivers just like me. So thank you.
Thank you, Katie. So we're going to move on to the content of the guidebook itself. Two of the writers who wrote the guidebook are here with us today. Kimberly Hogstead is a co-founder of Equity, a national nonprofit research and pilot lab focused on advancing systems and policy changes to create equal access to quality, affordable healthcare for those with rare or serious health conditions. She is also a partner and president of Action Partners, a consulting firm. Prior to Equity, Kimberly served for over a dozen years in rare disease patient organizations as the CEO of Global Genes and as president and CEO of the Hemophilia Federation of America. Dr. Mosemi Bose is the mother of a son who was born with Zellweger spectrum disorder, a rare life-limiting genetic disease. As a result of her personal experience with her son, Dr. Bose refocused her career goals to study rare disease. Over the last several years, Dr. Bose has conducted research and published multiple papers on the role of the family caregiver in the management of rare pediatric disorders. Currently, Dr. Bose holds a faculty position in the Department of Nutrition and Food Studies at Montclair State University in New Jersey, studying quality of life in rare disease patients, caregivers, and families. Now I would like to pass it over to them to tell you about the content of the guidebook.
Awesome. I think this is Kimberly. I think I'm up first. Hi, everybody. Kimberly Hogstead, and I really appreciate the introduction. It has been such a privilege to have been able to serve in the rare disease community over these many years. But I would say the biggest honor for me has been being a rare disease mom. I do have a teenager with severe hemophilia, and despite the life's ups and downs and hospital ins and outs, being my son's mom has been a tremendous gift. I do want to mention somebody who is missing today, our co-author, Teresa Smith. Terry is a research project coordinator at Penn State College of Medicine, and she's also a practicing nurse, a home care nurse, an amazing lady and contributed greatly to this handbook, but wasn't able to be here today. Terry and Mosemy were amazing co-authors with really important perspectives. I also want to thank the National Alliance for Caregiving for the opportunity to partner on this guidebook. It really has been an amazing experience. It's a great team, and I'm so glad to be here today. Mosemy, I'll turn it over to you.
Thanks, Kimberly. I'm also extremely excited to be here today. I'm so grateful that a mutual colleague introduced me to Grace Whiting a few years ago. And everybody at the National Alliance for Caregiving, as well as Global Genes and my co-authors, this has just been such a labor of love for all of us. And I'm so grateful that it's coming out, and I'm glad I'm here with everyone to be able to share this resource with all of you today. So I think what we'll do is we'll talk a little bit about how this guidebook came to be, and and then we'll get into just a brief overview of the content of the guidebook chapter by chapter, and then afterwards we'll all of us will be happy to take any questions that you have. So just to give you a little bit of a background of how my sort of experience in getting this project started, I was able. Grace invited me to participate in the advisory board for the 2018 Rare Caregiving in the U.S. study, and as a result of the data that we got, this is really what prompted the discussion on the development of this guidebook in around 2019. And the original idea here was to get guidance from professionals in the field that have worked with patients affected by rare and serious illnesses. And we were going to sort of travel around to these institutions and gain insight from them to develop the content for the book. And then in 2020, COVID happened. And so the plans for travel got scrapped. So we started transitioning into developing online focus groups. And during that time, we built up an advisory committee for this guidebook. And this advisory committee has been so instrumental in the initial development of the outline for this guidebook, as well as providing very valuable feedback when we were coming to the end of getting this released. So I want to thank that advisory committee, and I know that a few members from the advisory committee are here today. So when we were in those initial stages of developing those online focus groups, Lauren and Gabriella really did a lot of, Gabriella Prudencio, who was the former research director at the NAC, they did a lot of the heavy lifting in organizing the focus groups themselves, as well as providing some background research. Lauren wrote up an annotated bibliography that provided a lot of insight into developing the interview questions for these focus groups. The idea behind doing these focus groups, we eventually ended up transitioning, instead of interviewing people in the professionals in the field, we figured this was a guidebook that was meant for caregivers of rare and serious illnesses. So why not talk to them and find out what they want in a guidebook like this? And I can just say that, and I know that if Gabriella were here, she would probably agree with me. There was so much information that we gained from these caregivers. Me being a caregiver myself, I learned so much in these discussions. And I think it's just resulted in a very, a guidebook of very rich content. And I think that's been echoed in some of the introductions that we've had earlier in this conversation. So yeah, we conducted these focus groups in September of 2020 through October. And after that, we analyzed all of the data, and from that analysis, we developed this outline for the guidebook. And it was, again, there was so much information. There's so much rich content. I think we realized very quickly that I just did not have the bandwidth to author a book alone. So that was the time that we asked Kimberly and Terry to come in, and we have just been, and Kimberly, you can comment to this too. It feels like this is like one of the best team efforts that I've had the pleasure to work with. We were just such a good team, and I think that shows in the writing of the book. So that's just an overview, and again, so many people were involved in making this happen, and I'm just so grateful to all of them. I think I'd love to start talking to you about some of the content. Kimberly, is there anything that you wanted to add before we go ahead and get started?
No, I think you did a great job. Thank you.
Thank you. So, we just started the book, and if you could go to the next slide, just kind of introducing this topic of caregiving for children with rare or serious illnesses. And this first chapter really kind of breaks down sort of the nature of the focus groups that we did and some of the things that we found out. And one of the biggest takeaways that I gathered from these focus groups is that the emotions, the feelings, the experiences, the circumstances when being the caregiver of a child with a rare or serious illness, it's very, very complex. Obviously, there's a lot of challenges that we have to face. But one of the things that a lot of these caregivers really talked about were some of the positive aspects of serving in this role as a caregiver to a child with a rare or serious illness. And from these focus groups, participants reported that throughout their whole experience, they felt more empowered, felt like they were able to be better advocates. They were able to more clearly evaluate their career and life goals after having become the caregiver to a child with a rare and serious illness. Now, and this is something that was very strongly pervasive throughout every single focus group that we had. Now, just saying this is not meant to undermine the enormous challenges that these caregivers have, but rather sort of creating this kind of foundation of, the caregiver experience, especially to children with rare or serious illnesses. It's an up and down sort of thing. It's a roller coaster. And this is a word that a lot of our caregivers in our focus group use. If you look at outside literature, looking at caregivers of rare disease, you'll see this term used a lot, that it's this roller coaster experience. There's a lot of challenges, there's a lot of obstacles, but there's a lot of wins and there's a lot of highs too. So that's really what the initial chapter is meant to do, is to sort of set that foundation for what the sort of broad caregiver experience is like. And if we could move to the next slide, please. The next chapter is entitled Addressing Equity in Caregiving for Rare and Serious Illnesses. And, having established that foundation of the broad caregiver experience, it was really important to us as authors that the topic of inclusion and equity were front and center as important topics in this guidebook. My personal opinion is that even in this age of very heightened awareness for the importance of addressing issues surrounding diversity, equity, inclusion in different spaces, it's in the rare disease community, it's not that easy to address disparities, inequities within a community that already feels wholly marginalized. So our aim in sort of putting this chapter on equity in caregiving for rare and serious illnesses was to really move this needle forward by spotlighting the importance of how equity can be achieved within the rare disease space across so many different circumstances. And I'll hand it over to Kimberly to talk about some of the specific initiatives surrounding this topic.
Thank you. Yeah, I would comment that there are numerous initiatives that have focused on health equity and have been created in the last couple of years focused on disparities. An example that we mentioned in the guidebook is the Rare Disease Diversity Coalition, also known as the RDDC. The Black Women's Health Imperative actually launched this coalition in 2020, and it is just a great example of a really active group that is looking across rare disease and equity and public health and policy. This group is working on a lot of multiple health equity projects right now on the spectrum of anything from diagnosis to provider education, clinical trials, policy, patient advocacy, really across the gamut. I would also note that in this chapter, we acknowledge that families and caregivers come in so many different makeups. Male caregivers, single parent households, even children as caregivers. And we want to recognize that they are all really important in supporting a child with a rare chronic condition. Can we go to the next slide? Thank you. Awesome. So the next chapter is about getting an accurate diagnosis. And this is really an important chapter. I think getting a diagnosis can be incredibly challenging and very frustrating. That journey, we know, can take years with many specialists, misdiagnoses, lots of testing to eventually get a diagnosis. And sometimes you don't even get that. So this section and this chapter really addresses that multitude of challenges and provides resources to help on the diagnostic journey. So we actually call it the diagnostic odyssey in rare disease. So the chapter actually includes information on finding current and emerging centers of excellence. It speaks to research and testing programs and many resources. At the end of this chapter, we also reference the undiagnosed resources, which are really, really important. And there's a lot of hope today, even for ultra rare diseases. The science, the understanding, it is improving and evolving all the time, and in identifying new diseases and discovering new treatments is happening all the time. You'll find in the handbook as you go through that at the very end of each section, in addition to having links embedded throughout, at the end of each chapter, there is a helpful link section just to give you, the opportunity to touch these resources in multiple ways if you're looking for, just re-looking for something quickly. Mosami, I'll turn it back to you.
Sure. Next slide, please. So, once you have a diagnosis, or even if you don't, and you have a little bit more information about your child's disease, I think many caregivers can identify with the frantic Google search that we all do once we get this information. And really, this chapter is meant to help caregivers sort of go through that process of learning more information about their child's condition. And this chapter discusses a multitude of targeted resources aimed at helping caregivers find the most up-to-date information on rare and serious illnesses. So it includes, and what you'll find in the organization of the book, what you'll see is a description of, whatever the chapter is, followed at the end with helpful links. And here, this chapter includes links to national databases such as the Genetic Alliance Rare Disease Information Center. It includes links to these sort of broad umbrella rare disease advocacy groups like Global Genes, like the National Organization for Rare Disorders. It also discusses the importance of connecting with disease-specific advocacy groups and family groups. And in the chapter, it highlights a few of these disease-specific groups and some of the benefits of connecting with these organizations, as well as attending their associated conferences. Given the fact that the majority of the information that we tend to receive these days is online, this chapter does also address being able to search and evaluate sources of information, and gives broad suggestions of how to look over these sources for accuracy. Mm-hmm. So I will turn it back to Kimberly.
The next chapter is on managing health and medical care for your child. And this is a truly critical chapter addressing how to manage care. There's so much hope with many treatment advances, but still so many challenges in managing those daily needs Katie mentioned of children living with rare and serious illnesses. We don't hold back here. We address that the US health system is fragmented and it doesn't always work well for long-term chronic illness. Many physicians are working on changing the system and creating more coordinated care, but there is a long way to go and we're not there yet. There's work to be done. So in this chapter, we address that a caregiver navigates the medical, financial, and sometimes stressful journey, and the chapter supports the caregiver in the thinking process, really. There are useful checklists, such as what to look for in a healthcare team. If we go to the next slide, I think we show just some of the common core team members listed here with a little explanation or description. Certainly there can be other providers supporting a child's care, but this provides that baseline of what you might likely expect. The chapter covers collaboration across healthcare providers. It covers skilled nursing and home healthcare aides, and it also covers a bit on research and clinical trials. And there are some great research networks and programs listed, as well as some information on expanded access or compassionate use. Let's see, we also touched on resources like palliative care. I think Danielle and Parvati mentioned that earlier, pediatric hospice and mental health. I want to point out that these are meant as that starting point resource. If you notice something is not included that you are aware of, that is okay. We fully acknowledge as a team that we did our very best to get you started on your learning journey, but there are many more resources to be found. So, so maybe I'll challenge Grace at 2.0 in the future at some point as there are more resources emerging. The last part of this chapter really addresses the impact of COVID on caregivers and families with rare and serious conditions. We took a look at some of what the rare community has learned, what's worked, what hasn't, such as the dramatic increase of telemedicine, how trials have been impacted, et cetera. So a look back. If you go to the next slide, the next chapter speaks to the economic impact of caregiving for a child with rare or serious illnesses. And this chapter addresses the added stress and burden on that the financial impact of rare and chronic disease. It covers the critical importance of insurance and provides just a lot of resources, many resources for support. I love this chapter. I think it's my favorite one. It is so important and filled with really useful links and resources to support our very most vulnerable families in rare and serious. The next slide, I think there is a chart just as an example that shows some of the resources, the premium copay and coverage assistance programs that are available for families. These are really important with families struggling with the cost of treatments. In this chapter, we also cover government support programs, SSI, SSDI, medical waivers, Katie Beckett, CHIP, they're all noted here, to provide caregivers with a starting point in finding help. This chapter is important in providing some basics to get you started, but there are so many support resources individualized, oftentimes by state, to search for. We did point to 2 catastrophic illness resources in both New Jersey and Massachusetts as examples of what to look for, but there's just a ton more to be sought out. Lastly, I would comment that there are sources here for many other additional support systems to help with the financial burden, links for medication assistance, travel, lodging, meals, support, even emergency assistance. And I was personally delighted to be able to include the Helping Hands program in this guidebook. It is a financial hardship assistance program that I had the honor and privilege of supporting in my years as CEO at HFA. I know deeply how easily a crisis can happen with the high cost of medicine and care for families, and programs like this provide such a supportive hand with emergency financial support through those difficult periods. It can make all of the difference in the world to a struggling family. So this chapter really is to provide resources to help in those most vulnerable situations. Go to the next slide.
Okay, so up until this point in the guidebook, there has been a sort of primary focus on the clinical aspects of being a caregiver to a child with a rare and serious illness. I really like the economic impact chapter as well. It's one of my favorite chapters, and I will say that when I was caregiving for my child, we were a recipient of the catastrophic illness in Children Relief Fund from New Jersey, and it was such a boon to us. I feel that chapter on finances is a really good transition into the next chapter, where we really start to talk about, here we're talking about education and recreation, but as a sort of overall, we're talking about quality of life and talking about addressing what quality of life is to families affected by rare and serious illnesses, and talking about what can be done to improve quality of life in these families. So starting with education, this chapter focuses on what families have as rights to education for their child affected by a rare and serious illness. We talk about programs and resources, talks about what an IEP is, what a 504 plan is, and other educational resources that are really important in special needs families. We also talk about recreational and extracurricular activities, which is something that I remember in our focus groups, caregivers really talked about, something that was very challenging to sort of engage in. And, a lot of these caregivers shared some of the resources that they've looked at to help promote, recreation and extracurricular activities and other things that can facilitate such activities. And overall, what I feel like this chapter does is emphasize aspects and resources that can enable and encourage social and emotional growth for children affected by rare and serious illnesses. And if you could go to the next slide, and if we're going to be talking about quality of life for the patient affected by a rare and serious illness, I think what goes hand in hand is making sure that we address achieving quality of life for families, not just the patient, but the whole family affected by a rare and serious illness. And, the chapter starts out with addressing individual relationships within and across the family unit, and then transitions into describing some local, state, and national programs that may help improve quality of life for these families. So some of the topics that we discuss here include managing relationships with family members, including spouses, including siblings of children affected by rare and serious illnesses. It briefly talks about, touches upon respite and associated support. And one of my favorite parts of this chapter is that it talks about traveling and vacationing as a family affected by a serious illness. This is something that I never would have even considered was a possibility for me when I was taking care of my child. And the idea that, we can go and do, quote unquote, normal things as a family, while being a family that's affected by a rare and serious illness. I think it's just that's something that really spoke to me. So it talks about different places that you can go that have disability access passes or other, accessible opportunities for children affected by rare and serious illnesses. Something I forgot to say at the beginning is that, the idea of this guidebook was really meant to be, to sort of have something for everyone who is affected by a rare and serious illness, not just a specific group. There are people in such, in a variety of stages in their journey and are affected by very, very different circumstances across disorders. And the idea here, is to really allow, for something, there's something that's useful for every single person and every single family that's affected by a rare and serious illness. And I feel like that really comes out in this chapter. So if we could go to the next slide, I'll talk about the next chapter, which is, a little bit of a shift. But still a very important topic. When a child with a rare and serious illness turns 18, dealing with that transition of care as the caregiver to that child, it's the understatement of the world to say that this is a very challenging task. And up until recently, there hasn't been a whole lot of talk about it, and there's been very few informational resources. In the last year or so, there's been a few organizations that have really championed this topic. This chapter really is meant to help caregivers navigate this responsibility. It talks about how, what to do in terms of establishing guardianship, talks about estate planning, it talks about housing for patients affected by rare and serious illnesses once they become an adult. It talks about specifics like how to establish a special needs trust for your patient affected by a rare and serious illness. Another thing that this chapter talks about, because rare and serious illnesses are often life-limiting, this chapter discusses bereavement and grief support resources for families should they have to go through something like this. And again, the way that the chapter is organized, just like every chapter in the book, is that, these resources, these websites, these organizations, you can find them at the end of each of these chapters. So that is the chapter on life transitions and future care. The next chapter, if we could go to the next slide, is something that I feel like is also an extremely important topic when talking about caregiving for patients with rare and serious illnesses. And that chapter is entitled Self-Care for the Caregiver. So according to the Caregiving in the US study from 2020, the state of health for that caregiver is worsening, and it's compared to the data from 2015. So this is why it's important now more than ever to make sure that caregivers are aware of what options they have for self-care. As a caregiver myself, and in discussion with focus groups and with other families, I feel like this term self-care is just thrown around and told to caregivers, make sure you engage in some self-care. But there are very few resources that are comprehensive enough to share feasible options of what caregivers can do with respect to self-care. So we attempt to try to address that in a real life sort of way. So in addition to providing suggestions on how a caregiver can individually engage in physical, mental, or spiritual avenues of self-care, the guidebook also shares resources and real life opportunities and options, for facilitating things like respite in caregivers. And I'm going to switch over to Kimberly now because I need a sip.
And the next slide covers the next chapter, getting involved in caregiver advocacy. There are so many ways to advocate, and it is really natural to want to engage as an advocate for a child. Frankly, advocacy happens at the doctor, at the insurance company, at school, with government policy. There are just many, many ways. From a state and federal policy perspective, there are so many state and federal bills that exist that support rare disease. There's newborn screening in the states, genetic counseling accessibility is a federal bill right now circulating, and so much more. This chapter gives a launch point to give you suggestions and outlets to find in being an advocate. It points to the National Rare Disease Day, and also World Rare Disease Day. It also points to Rare Disease Week, the National Week. That event takes place every year, focused in Washington with our federal legislators, and brings all rare groups together to advocate for common policies that impact rare. But honestly, you can advocate anytime, and caregivers do. And this chapter simply is to help point you in that direction. The last section in the guidebook is simply an appendix. If we can go to the next slide. We wanted to point this out. We went back and forth as a group, and if we're having helpful sites at the end of every chapter and we're embedding links, do we need an appendix? Then we really came back to the fact that an alphabetical list at the back might be just one more way for ease of lookup for our caregivers. So we thought it was important to include at the end of the chapter. Overall, I am totally biased here, but this handbook is a great tool, and I so hope it's useful to you. Other resources and tools are created all of the time in the rare disease community and should be leveraged. You can leverage this as a launching board and understand that other tools and resources are emerging. This tool is comprehensive, but it is not exhaustive, so we did our best to give you a place to start. I hope that this gives you some confidence and reassurance that you have support along the rare disease and serious disease journey as a caregiver. It really does take a village sometimes, so this provides you with some village resources. And it was such a blast to work with my co-authors, Terry and Mosami, as well as the whole NAC team. Grace and Lauren, you guys are amazing, and crew. Thanks to each of you. I think we developed something really special here for the community to benefit from. Mosami, turn it to you.
Yeah, I agree. I think, I really am just very proud of, what we've managed to create here. Sorry, I'm still sort of recovering here. But I feel like we had a really great team of authors. And as Kimberly said, this is, meant to be a starting point, to make connections with some of these organizations that have been listed here, and really, it's up, you have the possibilities as caregivers to really take it to, a much further sort of place. And, maybe there is room for a 2.0 somewhere down the road. I'm going to repeat what a lot of people have said here. I really wish that I had a resource like this when I was raising my son, and but I'm glad it's here, and I'm glad it's available to all current caregivers of children with rare and serious illnesses. And I'm just so thankful to the NAC and all of the organizations that made this guidebook happen, just for including me, and all of us as a part of this, because this is pretty special and meaningful to me.
Thank you both for walking us through the guidebook and sharing with us what's in it, basically. I want to turn it over to questions for everyone. Feel free to write questions in the chat. If you want to come off mic and ask questions, that's fine as well. Please just try to direct it at who you want to ask it to. So if you have a question for the writers, Kimberly or Mosami, or if you want to speak broadly to everybody, we have Danielle, Katie, and Parvati are all caregivers to children with rare disease. So they are good for questions as well, whatever you may have to ask. Grace, go ahead.
Thanks, Lauren. I'm taking CEO prerogative here, but as I was listening to the wonderful presentations, one question I had is, as rare caregivers and as people who work closely with populations that are managing rare disease, what advice would you give to those who are trying to reach them, to provide services or resources or guidebooks like this? How do you reach a group of people who may not even realize that what they're doing is above and beyond what we think of as taking care of each other? And that's for Lauren, that's for anybody.
Yeah, I'll start us, I guess. I would say that, just don't stop with one approach, keep looking. And there are so many resources out there. Don't limit yourself to one, one organization, one resource, one handbook, whatnot. Just be curious, I think is really, really, really important.
And I'll add to that, I think, what I remember being, in my experience in being a caregiver is that I was just overwhelmed and I had no time for anything. So in doing this research, I found one of the things that was so beneficial to me is looking at who was around me. And if I could delegate, can you look this up? Can you do this? Actually, the Catastrophic Illness and Children Relief Fund was something that a friend of mine had brought to me because she knew of our circumstances and she was just listening to NPR one day and heard about it. So, rely on your close-knit team of people around you to do some of this sort of research for you, because, it's at everybody's fingertips. So they, allow them to, to help you in this process, because you're not going to be able to do everything.
Well, and maybe Mosami, to add to that, it's to give yourself permission that it's okay to let people help you. It really is. And your friends and your family want to help. So give them something to do.
That's really hard. I had a hard time, I know there's a section in the guidebook that talks about nursing care, and I won't lie, bringing a nurse into my home, doing all the things that I've been doing for the past 8 months was something that I had to really sort of mentally kind of get over. I know it sounds silly, but it was just like, well, this is who I am. This is what I do. But it made all the difference in the world for my own mental state to allow somebody to come in and help me do what I was supposed to do. My parents, my husband, my sister, all of these people are very instrumental in helping us take care of our child.
I want to add to that, Mosami, and share that I'm very similar and feel what you just said so deeply, because my son is 21 now, and I had a nurse case manager that recently asked me, why did you wait so long? And there's so many layers to that answer. There would be another webinar for it. But I wanted to even add that from a caregiver perspective, going through this book, you will see, and it's validating to see words on paper that speak to you. And I know Kimberly briefly mentioned in the economic area about, you didn't shy away from some of these difficult topics and what you were sharing. But also in other areas, quality of life and self-care really speak to me, because we didn't, the authors didn't shy away from these really challenging topics that I know are happening in homes every day and that they need to be talked about. And so when you read these words, it's validating to know that you're not alone. But then what most of me shared about having that friend that shared that resource. This is where I think there's just a huge opportunity. And while I wish I had this guidebook so many years ago, I want my mom to have it. I want my uncle to have it. I want my friend to have it. I want the social worker to have it. I want all of these different people, because like most of me shared and other caregivers on here know, we are so overwhelmed, especially early on in the diagnosis. And there's just so many different seasons of being a caregiver. And I think that once you have this in your hands, you'll be able to pick it up at different times. And the education area may really speak to you. Or, you know, for me right now, I've transitioned to an adult care, and now I'm looking at that self-care area and really feeling that area. So I just really feel like it's for everyone, not just caregivers, because most of you gave a perfect example of a friend being able to access and know that this could help you and save you that time, because as caregivers, we don't have that time.
I just want to add to Katie's point. I think one of the things we most commonly hear, whether we as caregivers look back or when we work with other organizations as part of Global Genes, is that it's very isolating and it's a very difficult journey. And so whether you're an organization that can share this book with members in your community as a starting point or as a continuum of just something to look into, if there's a part of your care that, oh, you know, you're not a new rare disease mom or a caregiver, but maybe there's something in this book that may talk to you, like to Katie's point, you know, it's a continuum of, it's a book that appeals to so many different topics. And I think therein lies the beauty of it, is that they've tried to cover as many topics as possible. End of life may not be something that you think about as the first thing you think of when you get a diagnosis, but it's there. So if you're there at that point, and I feel like that's the unique perspective. So if you're an organization sharing this with the members of your community, if you are a patient yourself, sharing it with other parents, you know, the social media is such a powerful tool. But if you work with a hospital, then maybe sharing it to that social worker who can then give it to that family who is sitting there feeling isolated, feeling like, what have they just told us? Then there's just so many different aspects to this. And so hopefully, yeah, with part 2, we'll delve into it more in detail. But for part 1, I think it covers a lot already that can appeal to everyone that's reading.
I'm going to add again, I'm sorry, I have a lot to say. This is obviously a passionate topic for me. I think that even leaving it in a lunchroom, you know, where you work, being able to have access to this for so many different people, they can then maybe even just have a new level of empathy for caregivers. And it could inspire them to get involved more, to not only just support the caregiver with running an errand or giving them the 10 minutes that they may need to just do some mindfulness, whatever their self-care may look like, but they may get involved at a higher level of advocacy as well. So I really think just having it accessible to other people, to provide the opportunity to increase that awareness and increase empathy for what caregivers are going through and the challenges we have, it's just a huge opportunity.
And one more thing I'll add to that is that, you know, because, you know, you brought it up, Katie, there are parts in the guidebook, I think especially in that self-care chapter, where, you know, like I said, this guidebook was meant for caregivers of rare and serious illnesses, but there are parts of the book where we actually address you know, people that know people that are taking care of children with rare and serious illnesses, and offer suggestions of what may be constructive ways to help. And I think that's kind of important, because I remember in my own experience that a lot of people were like, I wanted to reach out, but I didn't know what to say, or I didn't know what to do. And like, I think this guidebook, at least for at least a brief part of it, offers, you know, some resources for not just families affected by rare and serious illnesses, but people who know families affected by rare and serious illnesses.
It also highlighted in the guidebook how important it is to recognize that we can give you all of these resources and we can make these recommendations, but they may not be appropriate for this caregiver at this time, and that's okay. And that while this resource may not be something that a caregiver wants 5 years later, when they're still caregiving, they may decide they do want that support. And so really not just providing the resources, but recognizing and helping others recognize that what you may think will help someone, that's not the right fit for them, and that's okay.
Danielle, I want to give you a chance if you have any parting words as well.
Well, It may be part of your plan. I hope if there's the physical version of this maybe could be available through genetic counselors' offices, you know, at that exact point of diagnosis when I think so many of us experience sort of a fog of you can only hear like one thing. And then often you're given a diagnosis and you're given a 2-page pamphlet on your disease, if there is one. And it's just, it feels almost insulting that your world has changed and it's going to be summarized in this 2-page pamphlet. So I would rather see it summarized in this 55 book that you just made, which is probably, as you said, a much better way to get to what you need than some of the other options that we've been forced to accept up until now.
Thank you so much, all of you, for being here today. Thank you to our speakers for coming and joining us and telling us about the guidebook and about their experience and how it can be helpful. Thank you to everybody who joined, who came in to listen to the guidebook walkthrough. The guidebook is available on our website right now. Currently, it's digital, so you can click straight through to those links and resources that we mentioned. It's located on our website at www.caregiving.org/guidebook-for-caregivers-of-children-with-rare-disease-illness. Don't worry, you don't have to memorize that. I'm going to send you this recording along with the link to that guidebook. And now I'm going to turn it over to Grace for final goodbyes.
Lauren, I just want to thank you for your leadership on this. And of course, thank all our wonderful speakers and Global Genes for your partnership and others who contributed to the guidebook. As Lauren mentioned, this will be recorded. And I love the idea of sharing this not only with people who may be caring for someone with a rare disease, but for that friend or family member or neighbor who's saying, I don't know what to do. What can I do? How can I help? So thank you all so much for being here. And thank you to Mallinckrodt Pharmaceuticals for their generous charitable funding, which allowed us to create this guidebook. We look forward to seeing you online and hopefully again in person someday. But please be well, stay safe, and thank you all.
Bye, everyone.
Thank you.